Thank you so much for everyone sharing thus far. I've learned quite a lot. Special thank you to Leela for having me here this morning. So, with regards to the different medical conditions, I just want everybody to be aware that what we are focusing on is having heavy periods, long periods, very painful periods, chronic pelvic pain, gastrointestinal systems symptoms, as well as the psychological impact of going through these things, such as, anxiety and depression. So what I wanted to talk about first is PCOS, or polycystic ovarian syndrome. Okay, it is a disease that is caused by an hormonal imbalance in women, and it impacts on the development and the release of healthy mature eggs every month, the process that we call ovulation. And this is the primary issue that causes irregular menstrual cycles or menstrual periods in women. They can also experience heavy menstrual periods also. Okay. Also, we also want to highlight endometriosis. Okay. Does anyone know about endometriosis by chance? Not sure if most do. But endometriosis refers to the growth of uterine-like tissue outside of the uterus. And these tissues that lie outside of the uterus, they also behave like the tissues in the uterus, and they are subject to changes during the hormonal or the ovarian cycle. So when a woman has her period, these tissues shed as well, and they can lead to excruciating pain during periods. Women can experience heavy menstrual bleeding, chronic pelvic pain. They can also have some very vague symptoms such as back pain, stomach pains, vomiting, even diarrhea as well. So it's a very, very serious condition. Also, I wanted to highlight uterine fibroids, which is a very big thing in the Caribbean region, particularly amongst Afro-Caribbean women, where a lot of women are experiencing a lot of these symptoms, such as heavy menstrual bleeding and irregular cycles and bleeding between their periods, chronic pelvic pain as well. Why we are highlighting all of these things is because they do have a significant impact on the menstrual hygiene practices that women experience every month or when they do see their period. Because when someone has an irregular cycle, they aren't really sure as to when they are going to get the period, which means that they have to always keep products on them in their handbag or at work or in their vehicle to adjust to their environment based on when the period actually comes. Right? A lot of women who experience heavy menstrual bleeding, there's an increased consumption of menstrual products, okay, such as the sanitary pads, sanitary napkins, the tampons, the panty liners, having to bring extra clothes with them. Okay, and even also packing medications, because with all of these symptoms, they're they can be very tired. There's an increased risk of infection as well. Always have to be prepared. So there's a cost factor when it comes to, ensuring that they have products with them. Okay, there's also an increased consumption of the hygienic products, such as, the hand sanitizers, the soaps, having access to water, a well-equipped or a period-friendly bathroom. That it sounds simple, but it's a very serious issue. And when women are experiencing these symptoms every month, what tends to happen is that this can contribute towards absenteeism at work because, when the period comes, some women prefer to deal with it at home instead of going to work. So there's a reduction in productivity for the organization as well. A lot of women, they are psychologically impacted by these issues as well, depression and anxiety, especially if it is that they aren't really aware as to what is causing their symptoms. So the whole point about it is that we have to continue to be advocates of increasing the awareness as to some of the diseases that can account for some of the symptoms that women have when it comes to their menstrual cycles and their periods every month. We need to continue destigmatizing, having these type of discussions. I know that there was another panelist who would have spoken about religious organizations. That's a big thing because I think that as a young girl growing up, or young girls and boys, religion plays a big role in terms of how people view their bodies. And if you can get religious organizations, government institutions, the private sector, really creating that culture of discussing issues with regards to menstrual hygiene, reproductive health, and even sexual health, it would allow for that healthy discussion and for persons to get access to accurate information, and it improves positive health seeking behavior where women are then able to be motivated to seek medical advice and to be screened earlier on, and to start getting treated if they are diagnosed with a specific problem, so that it lessens their symptoms or burdens, if that is a better way of describing it. All right. Also, I wanted to highlight the fact that on the level of the government and the health systems, I think that we as doctors have to continue to play a bigger role in being an advocate for educating people with regards to their menstrual issues and menstrual problems. Right. I believe that there has to be an integration within a more public health system where we have clinics that are dedicated towards educating both young girls as well as women about the menstrual hygiene, as well as their sexual and reproductive health also. Okay. Also, we need to integrate these discussions more with the education system to continue to educate both young boys as well as young girls about about women's health issues, so that they understand it's something very, very serious and it's not something to be laughed at, something to be scorned at. Okay. Also, I think that just generally, we need to continue to encourage individuals to start getting the truth, because there's a lot of myths and beliefs that many people in Trinidad may have about a variety of issues that affect women's health and menstrual health. One thing in particular comes has to do with endometriosis and period pains, because sometimes when a woman, she is going through her period, she may not want to have that full discussion with her employer, but sometimes there in certain organizations, period pain is looked at as just like a normal routine thing, but for somebody with endometriosis, the pain can be excruciating, and the physical and the psychological impact of this disease can can really be detrimental to that person's livelihood and everyone around them. So one of the things is to understand that everybody's period pain is not the same. Everyone should be treated with dignity and respect. Everybody should be acknowledged when they say that they aren't feeling well. And it's a matter of not just acknowledging it, but also championing and encouraging that individual to seek medical advice to really identify what is going on with them, so that they're able to get treated and really live at a higher level holistically. Okay. So I'm not sure if you have any questions.